Hi there, and happy Monday to you all. My name is Julie Hirschberg. I am a neurologic physical therapist, the owner of Reactive Physical Therapy and Wellness. It is a neurologic PT PT and fitness studio. We have two locations in Los Angeles and Torrance, and we're also home of the Schmidt Movement Disorders Fellowship, which is really the only neurologic-based fellowship program for PTs in the country. And one of the reasons we're talking about functional movement disorders today, because in the fellowship, we see this a lot, we see it in our practice, and we're constantly trying to understand it even more. So our mission at Re+active is to help people with neurologic diagnoses recover movement and strength and confidence. And we really do this by targeting the brain-changing therapy and exercise. We have one-on-one therapy, personal training, yoga therapy, group exercise. We also do a lot of education with other physical therapists. So if you haven't met us before, welcome. Thanks for joining in. You can learn more about us at our website, which is reactivept.com. And today's topic is on functional movement disorders. And we said harnessing neuroplasticity for brain change. And I cannot even tell you how excited I am for this. If you don't know this about me, many people do. I'm kind of crazy about the brain, about neuroscience, and in particular, some of these more rare, invisible, misunderstood diagnoses. And in our last Facebook Live, we talked about dystonia because this is another one of those misunderstood diagnoses. And in particular with functional movement disorders, one of my biggest frustrations is that people go an average of a whole year before they even get the diagnosis. And they go through the whole medical system, provider after provider, and people telling them they're crazy or it's in their head. And this is just unnecessary. And it's really causing suffering for the people that we work with. And so I'm just so driven to get the word out and to share about functional movement disorders so that people can improve their understanding. So let's start with just what this is. So if you're totally new to this, what is a functional movement disorder? So a functional movement disorder, by definition, is characterized by involuntary but learned habitual movement patterns that are driven by abnormal self-directed attention. And there's a really great article by Nielsen in 2016 that puts that out there. What is important about the functional movement disorder is that it's not due to an isolated neurologic lesion. So like a stroke, for example, where you get like something very clear showing on an MRI and a very isolated lesion, that's not happening in a functional movement disorder. But there is something happening. It's not made up. It's not fake. There is indeed things happening in the brain, and we're going to talk about that. But the function or the connectivity in the nervous system is impaired. That's the big deal. And because now we have a better understanding of the connections between physical, social, psychological influences and connectivity in the brain, functional movement disorders are being more and better understood. It kills me that back in the day, these were often called hysteria, conversion disorder, psychiatric disorders. And you know what? You will still find that today. We see that in some of our clients. And it actually really, really is so detrimental. And I think there's a huge push out there by movement disorder specialists to help in this terminology. So we understand that for many people, there's not any kind of psychological disorder at all. So that really begs the question, what is it exactly? And honestly, there's still so much to be learned, but we're understanding more and more daily. And because of the brain lover in me, I really like in dystonia, I really like to understand this pretty deeply. And so there's a great amount of literature looking at research, looking at what the underlying issue is. One of the analogies we brought up last time, excuse me, in talking about in dystonia, is that this idea of a software problem versus a hardware problem. Functional movement disorders are another hardware problem, meaning a connectivity issue versus that lesion, right? So the software problem, very, very helpful. And the software problem comes back to that definition in the functional movement disorder, including self-agency. And when I first started reading about this, I didn't really even know what self-agency meant. So self-agency is that idea, the awareness that I am the person responsible for my own movements. And in the brain, this relies on a constant state of monitoring internally. So like if we think of just kind of our basic movements, we have to be willing to move. The movement happens. Our sensory systems give us a lot of feedback to indicate that something has happened. And by definition, impairment in self-agency, that is functional movement disorder. So people who have a functional movement disorder lack that normal neural connection between the volitional movement and appropriate sensory feedback. So these involuntary movements are occurring because of that lack of connection. So, of course, there's a ton of really interesting, cool neuroanatomy, neurophysiology that happens with this. And I'm just looking over here at the comments. Thank you, Amy. Amy's preaching truth here. I think a lot of us as PTs, as neuro PTs, really understand, and we hear from our patients this frustration with not being understood and things being invisible. And, you know, I think a lot of us really feel that frustration, and it's not with just neurological diseases. There's a lot of diseases that way. And I have a personal passion for working with people like that. So thanks for joining us, y'all. But going back, so fMRI is one way for us to look at what's going on in the brain in functional movement disorders. And there's a lot of really interesting research literally coming out like every moment here. And if you're not familiar with fMRI, basically it looks at activity in different regions in the brain. And they typically use this blood flow technique, indicating like higher blood flow to different areas, meaning higher demand. And what they have found in many fMRI studies is that there are abnormal patterns of cerebral activation, along with abnormal connectivity, in particular between the limbic systems and the motor networks. And so as a summary of these, I'm going to go into a couple of studies here. The functional movement disorders can be viewed as disorders of networks that are implicated in volitional movement, emotion, and motor control. And they might be facilitated by attention. And there's a lot of mights here because these are often really small studies, and we're trying to really understand what the data that's coming out. So there are some huge neurology groups that have some great studies. Mark Hallett leads one of the groups, and one of the fMRI studies that he looked at was really quite fascinating. So he was most interested in the right temporal parietal junction. I kind of think of it as right here, but right where the temporal lobe and the parietal lobe come together. This is an area where we know is related to the sense of agency. And so because it's part of functional movement disorders, he wanted to look at that very specifically. That part of the brain also plays a really important role as a mismatch detector. So a feedback pathway from the motor event to the sensory perception. Please bear with me with this neuroanatomy, because I promise this gets to the neuroplasticity part, why it's so important for treatment. So the temporal parietal junction It is networked to multiple areas, of course, the motor cortex, the cerebellum, the supplementary motor area, really critical in, junctions. Other key areas, the posterior cingulate and the precuneus, which is part of the superior parietal cortex. Another really important part when we think of treatment, because that area transforms visual information into motor command. So when we think about treatment as altering some of that visual information, improving some of the visual information to help the motor output, so important. So in this study, what he found in comparing people with functional movement disorders to people with healthy controls is that they really did have an impairment in the right temporal parietal junction. So just really kind of proving or showing that link existed. So that was huge. Another really cool study that he had, and I love Mark Hallett for this, he's the researcher again in his group. You know, there is this misconception that people are faking it, that they're making up these movements, and that they're actually voluntarily controlling it and saying that it's not. And he did this brilliant study to show, no, that is indeed not the case. So thank you for dispelling the faking it myth. But essentially, he put people in the FMRI and had them fake it, had them pretend to do and to show their tremor. So they voluntarily did the tremor, and then they involuntarily had the tremor. And what he could find is a clear difference in that right temporal parietal junction. So here, he totally dispels the myth. Look, there is a connectivity problem. People are not faking it. And he also dispels the myth, actually, that there's nothing wrong here. There indeed is something wrong. We just don't have great tests to show it. We need something like functional MRI to show it. Now, he wasn't advocating that everybody gets a functional MRI. This was not a diagnostic test at all. But I think we're moving in a direction to better understand this. There's another neurologist, Dr. Lefevre, out of Louisville. She also feels very strongly that we can now diagnose functional movement disorders based on a clinical exam. It doesn't have to be a diagnosis of exclusion. So very, very powerful. I think we are going to see a future where it doesn't take people a whole year to get diagnosed with this. And how amazing would that be? So there's a little bit of background. That background about these connections between the brain is so important because it drives our treatment. Because in essence, what we can do and what people can do for themselves is help establish better connections in those areas. And the good news is that for neuro-PT, driving connections is like what we do. It's what PT is all about. So when we talk about treatment in functional movement disorders, we usually talk about a couple of key components. It's actually fairly similar to our approach with dystonia and frankly, a lot of neurologic diagnoses. So one of those things, and when we think about connections, this is so huge, is the prep work for the nervous system, setting us up for a good substrate for neuroplasticity. And a huge part of this is education. We can see people transform, and I see Chelsea Duncan joined us. She's so brilliant at this. She is one of our physical therapists, and she recently had a patient with a functional movement disorder. Within that session, just completely transform the family, to be honest, with just understanding the diagnosis, so helping explain what it is, acknowledgement that there is a problem, that this is not in your head, you are not faking it, there's a true functional connectivity problem, and that we understand what that functional connectivity is, that there's an impaired sense of agency, there's a sensory perceptual problem, we can actually test it out and figure that out. So a huge part of that first piece is education. And this month actually at Re+active, we called it Spring Brain Cleaning Month. And I think this is so nice for this prep work for the nervous system. The real brain health component of our treatment is so important. And at Re+active, this includes that educational piece. It might include something like yoga therapy, which when you think of yoga, when you think of some of the breath work, I really think of restoring some of that connection to the body, and awareness is a big part of it. Addressing lifestyle factors such as sleep, for example, are really big components of that nervous system regulation. The second big part of harnessing the neuroplasticity is that real brain training. And again, this is that reconnection. So that prep work kind of lays down the substrate to have that neuroplasticity, to have those connections reform. And when I think about what we do, what we are essentially doing is returning that sense of agency, restoring those connections between the temporal parietal junction and the motor and sensory cortex. There's a few key components of that, and I'm not going to go into crazy detail. We actually submitted, along with Chelsea Duncan, Carly Lockala in Oregon, and Mike Studer in Oregon, we submitted to CSM to talk about this in particular for a whole 2-hour session. So we're not going to talk about it that much in detail right now, but some of the pieces of this part of neuroplasticity training would be we have to show that normal movement can occur. And this might be the use of some of our key motor control principles, like external cues. We may be retraining that movement with diverted attention. We need to improve the sensory perception part, because that's a whole part of that feedback loop. And then connect those two, the motor output to this with the sensory perception. That's all of those connections that are so important. So the prep work, the brain training work, all to drive neuroplasticity. And after all of that, I know we went really heavy in the physiological neuroanatomical part. I want to give a couple of take-homes for treatment. The first biggest thing is that you have to know as a PT, and you have to know if you are a person with functional movement disorder, so that you can share and know this is real. It's not in your head. You're not faking it. There's many other people like you with functional movement disorders. And in fact, Dr. Lefevre has estimated that about 20 to 30% of the symptoms that are evaluated in the neurology clinic probably have a functional component. And it's 6% of a neurology practice. So you are not alone. I love sharing resources like neurosymptoms.org or fndhope.org. It's a great way for a person to read up on these diagnoses and to know they're real and they're not alone. I can't even tell you how important that is. And we know that just having that hope, recognition, validation, understanding changes our brain circuits. So don't underestimate this step. Second take home that I wanted to talk about is getting a thorough evaluation with somebody who understands the diagnosis. This includes a movement disorder specialist neurologist. And there are definitely great resources out there. If you need help finding someone who understands functional movement disorders and you're in Southern California, please hit us up. We will help you find somebody. And even if you're not, we will try to help you find somebody. But the other thing is a specialist PT. We have had patients go for intensive therapy at really reputable places and be told they were faking it and end up worse than they started. And that breaks my heart. So really look for a specialist PT who understands functional movement disorders. Thirdly, third take home, and then we're going to wrap up. Because we understand that there is an impairment in self-agency in a functional movement disorder, self-management is a huge part of success. An ideal program is where the client is provided tools that they're able to implement on their own and even progress themselves. This is why education is so important. And some people have that misperception that PT is kind of a passive process with massage and some stretching and some manual therapy and then maybe a couple of exercises, and that just will not do. I mean, that's a misperception of PT in general, but in a functional movement disorder, that those kinds of things are not going to restore those critical connections. Having a plan that your client, understand that they have the power to be able to start taking control of movement is indeed what needs to happen to get to that underlying problem with the connection, right? So the first thing we said for take homes was knowing it's real, you're not faking it, getting that specialist evaluation by a neurologist and a specialist PT, and then making sure that PT program is addressing that self-agency. There has to be some portion where you're taking over control, autonomy, self-management. I could go on and on this topic. I'm super passionate about it at the moment. I hope you found it helpful. Please let me know if you have questions. We can help address those in future sessions or put those together. I did want you to know that, this is really part of our Schmidt Movement Disorder Fellowship. We get together every 6 weeks to learn and dive deep into movement disorders. So if you like learning with us, check us out on our Reactive Education page if you're a PT. We actually have our next learning module this Thursday at 6:30. It's all about Huntington's disease. And it's available via Zoom if you want to join us remotely. You can join us in person as well. But we just truly love doing this and sharing what we're learning. So we'd love for you to join us really for any of these, and you can find all of them on our website. Thank you so much for joining with us. If you found it helpful, please share it. And then actually just on Sunday, I'm going to the Huntington's Disease Conference at UCLA. I'll share a live update with you on Sunday evening as well, so you can tune in then. Thanks so much.